Should illegal immigrants have access to emergency medical care? So who should pay for it? That is the debate raging between state and federal governments right now. Bruce Weinstein is the ethics guy. He's a columnist with businessweek.com. Hi, Bruce.
Hello, Contessa.
All right, let's talk about the latest development here. The federal government has told New York we're no longer going to cover chemotherapy as an emergency treatment. Now, when we think of chemotherapy, we think of long-term cancer treatment. So how do you even, in the first place, consider that emergency care?
Well, doctors consider some forms of cancer, medical problems to involve emergency care, such as cancer of the brain, bone marrow, spinal cord. These can actually qualify as emergency conditions. And so to deny illegal immigrants chemotherapy is cruel. It's a violation of our duty to be compassionate and our duty to avoid harming people.
You know, it's interesting because on the one hand, you have doctors taking a Hippocratic oath to help people and to do no harm,
yes,
as you said. On the other hand, we have a lot of people who are citizens of this country who don't have medical coverage.
Well, we're talking about a very small percentage of the Medicaid budget, less than 1%. I mean, let's take one big step back. If you commit murder, if you commit rape, if you molest a child, and you go to prison, and you develop cancer, even if you're sentenced for life, you are entitled to chemotherapy. So why should we deny the care that we give to serial killers to a group of people, the overwhelming majority of which are doing their best to become contributing citizens in our society and are contributing to our economy?
All right, but if you're going to talk about the ethics of it, they broke the law by being here.
But once they're here, I mean, we're the only industrialized nation in the world that does not provide universal health care. And I mean, here's the ridiculousness of this policy. If you're a woman, you're entitled to breast, even if you're an illegal immigrant, if you have screening for breast cancer, that's covered. But if you're found to have cancer under this plan, it would not be covered.
Well,
how is that compassionate? How is that ethical?
But should it be covered? I mean, that's the whole point. Why are we compelled? I mean, I get it, do no harm.
No, it's not just do no harm, it's to be compassionate. You know, the United Nations is meeting in New York today, and it is time to put on our best face and show the world that we are the caring and compassionate nation that we historically have been. This attempt on the federal government to deny chemotherapy to a very small group of people, it's a cheap political ploy masquerading a sound ethical argument, and it is immoral.
Bruce, thank you.